Measles, a disease once considered eliminated in the United States, is making a troubling comeback. As of late April, over 900 cases have been confirmed across 29 states, with the majority concentrated in Texas. This surge is not just a statistical anomaly, it's a warning sign that the nation's hard-won progress against this highly contagious virus is unraveling. The numbers are stark. Texas alone has reported 664 cases since late January, with dozens hospitalized and 2 previously healthy unvaccinated children losing their lives. An unvaccinated adult in neighboring New Mexico has also died, bringing this year's national death toll from measles to 3. These are not just numbers. They represent families and communities grappling with loss, fear, and disruption. The scale of this outbreak is historic. In the past 3 decades, only the year 2019 saw more cases when a prolonged outbreak in New York City nearly cost the United States its measles elimination status. That status, achieved in 2000, signified that the country had gone a full year without continuous transmission of the disease. Now, with this year's case count already surpassing 2019's pace, the U.S. stands at a crossroads. At the heart of this resurgence is a decline in vaccination coverage. In 2019, 95% of U.S. kindergartners received the measles, mumps, and rubella, or MMR, vaccine, a level high enough to prevent widespread outbreaks. But by the 2023-24 school year, that rate had slipped to just under 93%. While this might seem like a small drop, it's enough to open the door for outbreaks, especially in communities where vaccination rates are even lower. Measles is one of the most contagious diseases known. A single infected person can spread the virus to up to 90% of unvaccinated people they come into contact with. The virus lingers in the air for hours after an infected person has left the room. It's not just a childhood rash. Measles can cause severe complications, including pneumonia, brain swelling, and death. Infants, pregnant women, and people with weakened immune systems are especially vulnerable. The current outbreak is centered in close-knit, under-vaccinated communities. Misinformation, mistrust, and barriers to healthcare have contributed to vaccine hesitancy. As a result, the virus finds fertile ground, spreading rapidly among those who lack immunity. The consequences are grave: hospitalizations, long-term health complications, and, tragically, preventable deaths. Experts are sounding the alarm. Modeling studies suggest that if current vaccination rates persist, the United States could see as many as 850,000 measles cases over the next 25 years, resulting in 170,000 hospitalizations and 2,500 deaths. If vaccination rates were to fall by just 10%, the projected number of cases would skyrocket to 11 million. These are not distant hypotheticals. They are plausible futures if action is not taken. The Centers for Disease Control and Prevention warns that the U.S. is at risk of returning to an era when measles was endemic, constantly present and spreading. Global travel further complicates the situation, as travelers can bring the virus into the country, igniting outbreaks in communities with low vaccination coverage. The solution is clear, if not simple: increasing vaccination rates. The MMR vaccine is safe, effective, and widely available. It not only protects individuals but also shields entire communities, especially those who cannot be vaccinated due to medical reasons. The resurgence of measles is a test of public health resolve. It's a reminder that progress can be fragile, and that collective vigilance is required to protect the gains of the past. The path forward demands renewed commitment to vaccination, clear communication, and community engagement. Only then can we hope to turn the tide and consign measles once again to the history books.